That's why when you take your baby in a hospital, the doctor is supposed or must take the history of how this baby was born. Babies usually undergo a lot of changes. Some are diagnosed at birth, or some are actually diagnosed prenatally. Hello, everyone. My name is Dr. Silva. Welcome to yet another episode of Ask Dr. Star, and today we are going to tackle a very, very important question usually asked in our daily OPD clinics, especially in the pediatrics. And that question is, Doctor, why is my child not gaining weight? And there are several factors, there's several answers to that question, which can either be due to a lot of maybe interventions that have not been done, and that's why this child is not gaining weight. First of all, how do I know that my child is not gaining weight? One, uh, parent will come with their child and is like, this is my child. He's actually 4 years old, but you check how my child looks like. You can count all the ribs of this baby. You can see the bony prominences. You can see the facial bones as well. So literally, you see that this child is not, or is looking cachexic. And the two is that every time you're going for immunization, they do what we call nutrition assessment, and they have the graphs and charts they brought to see if your child is really gaining weight. So those graphs will again also indicate that someone is not gaining weight, or is getting stunted, and it can also tell us how this child is doing with the weight gain. So several factors, and these factors can be grouped or can be categorized in different categories to know why this baby is not gaining weight. So we have nutritional factors, that is one. We have socioeconomic factors, and then we have maybe disease-related factors that can cause, and we have also what we call birth-related factors that can cause all these problems, or all these reasons why this child is not gaining weight. We begin with the most vital one, which is called birth factors, or birth-related factors. So that's why when you take your baby in a hospital, the doctor is supposed or must take the history of how this baby was born. Babies usually undergo a lot of changes. Some are diagnosed at birth, or some are actually diagnosed prenatally. So you find this mother, before giving birth, is told this mother that the baby has gotten fetal distress, and then they had to operate this mother. And then after operation, the baby was resuscitated after hours of resuscitation, and then the baby came up. So when the baby came up, is now living all those changes, all those complications that happened right away, stemming from what? From birth. So these are babies who get fetal distress, then fetal distress, birth asphyxia, and end up getting what we call HIE, and then HIE leading to maybe cerebral palsy. So now the cerebral palsy children usually they are slow at acquiring what we call developmental milestones, or the changes that happen to their body as a normal child. So if a normal child is growing at some rate, so you find this cerebral palsy baby is growing at a rate that is not as equal as the rate of a normal child. If it's acquire maybe the grasping skills at a certain month, then you find this one is like 3 months way back, or 5 months way back than the normal one. So their feeding habits become a little bit limited, swallowing reflexes become a little bit limited, and these are the minor mechanics that we use so that we can swallow and get what? And get food inside. So if those simple mechanics are not actually up to if they are not upright, then it means that this baby, the feeding habits are also not going to be what? To be okay. And then you find they are not gaining weight due to a condition that happened right away from birth. Now, there is another condition may be related to that is children who are born with congenital anomalies, especially we have what we call Down syndrome. These are also slow babies, and they acquire also those developmental milestones with time. So they can also, in those mechanics or those developmental milestones they are acquiring, then it means also the feeding habits are also there, they are slow. So this, we expect this baby also, the weight gain to be a little bit what? A little bit slow. Now, other congenital anomalies, maybe the congenital heart disease. Some children are born with maybe esophageal atresia. You find their esophagus is a little bit narrower, or it is stenosed. You get, and they have maybe congenital heart disease, and then they have these recurrent infections. Every time they have chest infections. Now, these infections also affect the immunity of this baby, and also after affecting the immunity of this baby, we expect also the gain in weight also to be a bit slow. So they have to be screening all those things that are happening: infections, congenital anomalies, and then also the cerebral palsy. All those ones are related to now the medical part of it. When we go to nutritional habits, now nutritional habits is that the parent knows what they are supposed to be giving the baby, but maybe because of maybe the time this parent is giving the baby, maybe the a lot of things are fixing us, and then we have little time for our babies. So you find the feeding habits are not up to standard. So if the baby is not feeding the way they are supposed to feed, and despite the food being there, then these babies are not going to get what? Not going to gain weight. So we find the feeding habits or the nutritional factors are also coming in. Then also the type of the food you're supposed to give your baby as the baby is growing. These babies are acquiring weight at a very at a rate that is very fast, because they need this food so that they can build up the energy and then grow up. So now you're slowing their process of growing up because you're not giving them the types of food that they are supposed to feed. So if you come to the hospital, they will have to teach you how you're supposed to feed your baby, and then your baby will start gaining what? Start gaining weight. And then two, we have what we call four, have what we call socio-economic factors. Of course, you've known in some parts of maybe our country whereby the malnutritional levels or malnutritional percentages are high in some certain parts of the country, maybe because they are the poverty, and maybe not getting the food that side. So it is just survival. Children are eating for just survival. You get? So find if the quantity, baby was supposed to eat this quantity, they are eating maybe quarters of that quantity. That baby will not gain weight the way they are supposed to gain weight. So maybe also if that is addressed, and those parts maybe they start getting the food they're supposed to get, and you find maybe these babies are going to what? To gain weight. So a lot of factors come in there to really tell why this child is not gaining weight. But as far as it takes, it is all surrounding the baby and the mother or the family factors that are causing a gain of weight to be slow or retarded. And some can be manipulable and others cannot be manipulable, or it is a test of time. We give it time, and we tell you the reasons why this child will actually take long to gain weight, but will eventually gain weight, especially for these babies with deformities. Yeah. Then for kind of infections, like we've said, a lot of infections. If a child gets recurrent infections, that child is not going to gain weight. That's a must. So it is all about immunizing our babies. When you immunize your baby, it means that you're preventing this baby from acquiring a lot of infections, especially these infections that come along with the babies. So if you immunize them, then they are not going to get prone to those infections, and then the gain of weight will be appreciated according to the nutritional graphs, or according to immunizational graphs and growth graphs. So so after knowing and appreciating that question of why my child is not gaining weight, along with the categories of the factors we've given you why this child is not gaining weight, then you devise means of how you're going to appreciate that. If it is gaining the information, we have what we call nutritionists can also advise, a doctor can also advise you, or even the pediatricians are there and general doctors are there to advise you on how your child is actually going to acquire weight. It is a matter of devising means of how you're going to combat all these factors. Thank you.